All physicians, in my opinion, should pay attention to climate change. It's a major public and personal health problem. It's going to get worse, not better, unless we pay attention to it. In fact, it's only the last couple of years that the major American and international medical bodies have come out and realize what the danger is of climate change if we don't do something about it.
All the physiologic things in the planet that I know of have feedback systems to control their growth. There are feedback loops that perpetuate climate change.
I care about climate change because our planet is our home, and I believe we have a moral responsibility to keep the earth livable and to prevent more suffering for people on the planet now and our children and our grandchildren.
I see our response to climate change and global warming as a major social justice issue. I also call it an intergenerational justice issue. So future generations are depending on us to do this.
One of the major concerns I have about climate change is its effect on developing countries. Developing countries are just beginning to provide enough food and water and medical services for their populations.
People are already suffering right now and dying from it. Poorest people suffer the most, and they're the least responsible for it. It's not just global warming, it's floods and diseases.
If you go to the CDC website, you'll find a great slide there which looks like a big circle, and it describes many diseases and many other conditions which could get a lot worse and will get a lot worse with climate change. And they're all interrelated. Pollution, which causes lung disease, cardiovascular disease, even strokes. Then there'll be the change in vectors, mosquitoes and other insects which carry disease.
I'm concerned about the flooding and the forest fires and the disasters. It's affecting people right here and right now.
And that is scary. And people respond to scary things by denying and avoiding. And somehow we have to tell them that prevention is still worth a pound of cure.
Florence Nightingale, she's the founder of modern nursing, right? She said, humans need clean air, clean water, healthy food to heal and to be healthy. My job right now as a nurse is that I am a wellness coach. And it's fascinating when you think about how behavior change is really central to the whole climate change conversation.
All of our health will be adversely affected by climate change if we don't become more active.
People, animals, plants, this is healing on the big scale. We're called to be healers. There's no more important way of healing right now than tackling climate change.
I teach in the School of Medicine here in Seattle, and I have access to students in a number of health professions: medicine, nursing, public health. And one of the things that we get an opportunity to talk about is how all of these folks in the health professions not only can provide good health care, but can also be activists and advocates for things that are important for health in this country. Advocacy and activism doesn't necessarily take up significant amounts of time.
The public is more apt to accept information from physicians who are interested in their problems and are trying to help them than they are from politicians who may be serving other purposes.
WPSR is leading the way in the Northwest and really leading the way in the country in getting health professionals and the public and our policymakers engaged in tackling climate change for justice, for a better environment, and for better health.
Threats to human health may not always be visible in everyday lives of patients or providers. WPSR is a larger voice for some of those concerns.
I support the work of WPSR because it's essential. It's no different from learning how to do something else in medicine, in my opinion. It is part of the medical curriculum. It is part of what we need to do as physicians for our patients.